Hello, good evening to everyone. Myself, Shama Keni, consultant psychologist at Antarman Center for Psychosocial Wellbeing, would like to welcome you all to this panel discussion on maternal mental health. I am very happy to bring to you our experts in this panel on the occasion of World Maternal Mental Health Day. 3rd May is celebrated as World Maternal Mental Health Day. However, as we wanted to conduct this session on the day and time convenient for the majority, we chose it to be a Saturday. So today we have in our panel Dr. Ravindra Agarwal, private psychiatrist based in Panjim. Dr. Agarwal is the director of Antarman Center and is also associated with Manipal Hospital and Sangat. Dr. Shivani Jain, who is working as a consultant in the Department of Obstetrics and Gynecology at Manipal Hospitals, Goa. She has done her MD from AIIMS, New Delhi. She is actively interested in spreading awareness and discussion about effects of hormonal changes on mental health and how to deal with them. Mrs. Misha Cholera, she is a counseling psychologist from Goa working with Antarman from last 9 years. Her specialty lies in women empowerment and anxiety disorders. And Ms. Priyanka Sinha Agarwal, an interior designer by profession and the newest mom on the panel. Priyanka has worked in corporates and business roles before becoming a designer. She is currently based out of Bangalore. I welcome you all. So my role today will be asking this panelists to speak about what they think about maternal mental health and maternal depression. So I have made a list of questions for them which I will be asking them. So this is a live stream, so I will not be able to contribute to the discussion, but however you can feel free to write in the comment section or ask your question. We don't promise to answer all the questions, but we will definitely address a few. So to begin with, I invite Dr. Ravindra Agarwal to talk about maternal depression and share his views on it.
Hello, very good afternoon, good evening to everyone. Can I just do a quick check to see am I audible? So yeah, I can see my other co-panelists nodding, so that means I'm audible. So thank you, Shama, for the introduction, and thank you for inviting me for such an important panel discussion on maternal depression, and and something which is so very relevant, as Shama said, that we had this maternal depression day on 3rd of May, and today we are having this panel discussion. So when we understand, when we talk about maternal depression, we talk about this mostly in the context of depression, which is faced by women during their pregnancy and the immediate postpartum period. For some reason, I'm able to see two of me. Probably this is because of the live stream, isn't it? Maybe. So I'm sorry about that distraction. So in terms of the perinatal depression, so whenever mothers are in the pregnancy period, so we often also call it as perinatal depression. So when they become pregnant, there are lots of changes which happens in the mothers because obviously the nature takes over their bodies. That's because of the hormones which happen, and also pregnancy period as such makes women more vulnerable. And then in a modern society where often women are working, they are not able to work anymore, because of the limits which happens to her. And immediately after the delivery, also when the new baby has come and the baby and the mother is getting used to the baby is getting used to the routine and is trying to set in the routine, that phase itself can also be very challenging, and that can predispose mothers to get depressed. Now, what I want to make a distinction here is that a lot of women go through mood changes in the pregnancy, which is called pregnancy blues, which is so common that we almost consider it as normal. That some amount of mood fluctuations happening during the pregnancy is considered normal, and that does happen is because the hormones which kick in, the progesterone hormone also has got some mood aspects as well. But when we talk about depression in mothers during pregnancy and postpartum period, we are talking about something which is much more intense, something which you don't get over, something which you can't just shake it off you. Now, it is like a depression which we talk about. It is where one finds that the mood remains low throughout the day, that nothing helps cheer them up. Whenever they are trying to do some work, every work appears that they have to put a lot more effort. They don't seem to be able to kind of enjoy things. They feel less confidence on themselves. They feel that life is really not worth living. Some people even may have suicidal thoughts. So these are the symptoms of depression which a mother may go through during the pregnancy period or immediately the postpartum period. Now it is, as I said, pregnancy blues is very common, but perinatal depression is also common. 15% of pregnancies we have perinatal or depression during the pregnancy which happens. Sometimes it almost approaches 20%, which is nearly every two pregnancies, every 2 out of 10 can suffer from depression. And the fact is that this is often missed. And it is so sad because the pregnancy period is the period where usually in a woman's life she is most in contact with the health services. Now, be it the nurse who may come home to check on, like in the rural settings, it could be the Asha Didi or the auxiliary nurse midwife who may come home and kind of register the mother. She comes home and checks on her immunization status, checks about her tablets, or in urban areas like in Goa, in our cities, the mother goes for antenatal checkup, and there again the mother undergoes a full panel of blood tests. She undergoes blood tests, she undergoes ultrasound, but often nobody asks them about the perinatal depression. And sometimes the mothers themselves are so ashamed about the feelings which they're having that they don't actually come forward to tell the doctor as to how they're feeling. Now, so there is an opportunity here, and that's why we are having this talk today, is that to increase awareness about the presence of maternal depression, that it is possible to just ask a few questions to screen them. There is a very easily available tool called PHQ-9, which is just a set of 9 questions. Anyone can actually administer that tool. It could even be the receptionist in the doctor's clinic or even a poster, and the person can answer those questions, and we'll be able to screen those people for possibility of depression. So I'm going to take a pause here. I just want to quickly just add a last bit, is that it is not only that this depression has an impact only on the quality of life during pregnancy, but it has been, now new evidence is coming in that this depression is affects the outcome of the pregnancy as well. That people, the women who are depressed in pregnancy sometimes tend to have more adverse obstetric outcomes. They tend to have more incidences of operative interventions, and there when it comes to the newborns, it has been seen that often if the mothers are depressed immediately after the delivery sometimes, or in the postnatal period, then the immunization often doesn't get completed. The children tend to have more hospitalization, and it affects the mother-child bonding as well. Okay, so Shama, I'm going to take a break, take a pause now, and back to you.
Thank you, Dr. Agarwal. My next question is to Dr. Shivani. So, Dr. Shivani, when you see a patient in your routine practice, how do you understand that this patient might be depressed, or how do you see the symptoms of depression?
Yeah. With respect to this pertinent problem of mental health during pregnancy and postpartum, I would like to say that mental health is an issue where most of the time clinicians just don't correlate with it, and many a times it is just put on the woman as she being maybe attention seeking, maybe looking too much at her own symptoms. So it is missed. Both the women fail to communicate and the clinician fails to pick up that something is not right. So we get, fortunately, as obstetricians, we get a lot of opportunity. We know our patients right from the start, and we do have time to bond. So many a times it is easy also to catch that if the patient is anxious, she shares a little bit of her anxiety. So from there, if you are sensitive and if you just don't dismiss the problem as something being hormonal, yeah, this happens in pregnancy, this is a very common thing. But if you listen completely, you would be able to pick up patients who are having sustained problem of anxiety, sleeplessness, overwhelm, and many a times patients do become tearful while sitting in the clinic itself. So, from a clinician point of view, it is slightly easier to pick up. What I would like to stress is also for family members to pick up, because women being women, we go through PMS, we go through a lot of hormonal changes, and it is easy to label as anything to be hormonal or to be one of those days, when in reality, we are just not in control. And with a little bit of support or with a little bit of intervention, these situations can be completely won over. And they are very, very common. As Dr. Agarwal said, that almost all patients, 80-90%, get postpartum blues, which are temporary, while around 20%, and these statistics cannot, well, they would be underplayed if not overplayed. Like 20% of them do go into depression. So it is not that we are making up a problem, the problem exists. And the clinicians have a role in picking up, but the family members, I feel, should be educated at every step, so that the woman feels comfortable talking to the doctor in the clinic, the doctor is sensitive and the family member is sensitive, so that things can be worked out in a safe environment. Many a times it is important to identify the stressor also, because sometimes there may be some previous history of depression or anxiety. Sometimes the pregnancy may be very complicated. The delivery process may be very complicated. The entire process of labor pain or operation or cesarean might make the patient undergo a lot of emotions. And sometimes patients do feel a loss of dignity during the whole process. Then also post delivery, since suddenly you are responsible for a new life, but the attention goes from you. And apart from hormonal changes, there are like significant body changes which are going through, and with huge amounts of energy and patience and responsibility being towards breastfeeding the younger one and taking care of the younger one. A lot of things happen. And I would also like to stress that being in Indian setting, there are quite a lot of stressors which we tend to ignore. Like I've seen when a female baby is born, sometimes the patients do undergo a lot of indirect stress, and do go into clinical depression because of the behavior around them and the expectation around them. If there is any history of violence in the family, so definitely it is important for the clinician to create a safe environment for the patient to speak up. But also it is important for the family members to be forthright and provide a supportive environment. Uh, I could go on a lot about the postpartum phase and what can be done and what cannot be done. But I think we have experienced mothers with us to help us understand that.
Thank you so much, Dr. Shivani, for sharing this very important information with us. So next, I would like to ask Nisha to shed some light on maternal depression from psychological perspective. What can be the reason for the mothers to get depressed?
Right. Hi, everyone. So, with the question asked, I would like to tell you that as a psychologist, as a counseling psychologist, our first priority would be definitely to stabilize or reduce any symptoms that are affecting the mother, like anxiety or nervousness, restlessness, any kind of heavy headedness, or any kind of insecurity. Definitely, our first priority is to stabilize any kind of physical or psychological symptoms. But while all this is happening, there is a very strong sense of grief, I feel, that is sensed by mothers. And with grief, I don't just mean loss of a person, but loss of, as Dr. Shivani rightly said, dignity, loss of self, loss of a career opportunity, or changes in relationship, changes in the body. And to deal with this loss is very difficult, because sometimes some mothers may have the support enough, but some might not. So while this is being catered to, there is another factor that is very dominant, which is the factor of most of the mothers try to pre-plan and try to prepare themselves immensely before they're going to deliver or while they're in their pregnancy. And they think that they know it all, but the surprise element hits so hard that the baby ends up teaching you how you are not doing it well, or how you are not providing the way I want it. And at that time, the expectations built between your partner or the family members, along with the mother herself, become so haywire that it's difficult to adhere to everyone at the same time, and it's difficult to please everyone at the same time. So that again is associated with a lot of negative and heavy emotions like anger, guilt, and regret, which again is can in itself become trigger points at various times of the day, and can make normal day functioning very difficult. Apart from this is also another factor that does cause more of sadness, is the interpersonal deficit that the mother feels, especially from friends or from people that she meets outside who are already parents and who give a free encyclopedia of how they have been dealing with their children, and especially at the times when it is not needed, totally unnecessary. But the pressure and the comparison that is made mentally by the mother is so high that it's difficult to uh, chase every satisfactory point, and it can become very overwhelming to please everyone and yourself at the same time. Now, apart from all of this, there is another major factor why women actually feel so depressed eventually, is because there is definitely a lack of communication between family members. There is a lot of intimacy struggle that happens between partners, between the husband and wife. And again, with all of these factors coming in, family life becomes difficult as a whole. And that is when the focus from just the mother and baby relationship becomes more distorted, and it becomes about that nobody is able to understand me, nobody is getting my point, and I'm all by myself and I'm all alone. So the loneliness creeps in, and with the help of therapies or with therapeutic techniques, what we aim at giving them, these mothers, is a sense of safety, security, and a sense of ability that everything is going to be okay with time. Also, there is a lot of techniques that can be used in order to give them more of a peaceful mind, that through mindfulness, through meditation, through focused breathing. There are many techniques that can physically help mothers get over these symptoms and feel better by the end of the day. Does that answer your question?
Yes. Thank you so much, Misha. So we also have with us Miss Priyanka, who is the newest mother on the panel. So I would like to ask you to share your experience, to share what are the challenges you face and how did you deal with them.
Sure, thank you, Shama, and hi everyone. My pregnancy has been really beautiful and involving for me and for my partner. And as Misha said, that you think that you know it all when you start your pregnancy because you do all the checklists, doing a proper diet, doing proper exercise, reading all the right things, having your consultancies with the right doctors, and then you start your pregnancy. But that some point it will hit you. You don't even know what kind of issue that would be, which maybe you have not addressed earlier, mentally, emotionally, physically. And for me, it was an emotional one. So it's been almost a decade and more than that. I'm not staying with my own mother. I am from Jamshedpur, and then at very early age I came to Bombay, and I made my career there. I married and then settled with my family in Bombay. So it's been 1.5 years when I came here in Bangalore. So in pregnancy, then you really at one point you think of a support system, right? Because you always hear these stories from your friends and family that, okay, during the delivery, your mother is here, right? And if you do not have a very great relationship or that rapport, or maybe the situation that your mother can come and support you, then what you really do? You feel really lonely. I don't know, you can call it anxiety, but a feeling which is very unique, which you must have not experienced ever. But you start to feel that, okay, there's nobody for you, there is no support for you. Then what are you going to do that? So yes, I did feel the anxiety for a couple of weeks maybe. And then I started to, console myself that I know the situation. I know that this is what the relation I hold with my mother, and this cannot happen. But at the same time, I'm very fortunate to marry to a family which is a very supportive family, a very loving and a caring and husband, a very caring mother-in-law. So I always thought that if not my mother, my mother-in-law is there, and she is going to support me. She is going to have that vacuum, filled by her in my life, right? And we do share a very great relationship. But we never had that comfort where we are staying for a couple of months and then she's looking after me the way my mother would do. But we had no option. My mother-in-law was here, and it was such a beautiful experience with her. I'm not even sure if my mother would have done the job that my mother-in-law has done. I'm sorry.
It's okay.
So yeah, it's a time when you really understand who is your support system, and we are conditioned in a way that your mother-in-law in a certain way that she cannot take a place of your mother, and she should not, because your mother is different, your mother-in-law is different, right? With your mother, a lot of time we get so comfortable that we do not lead a required routine, or we do not follow a certain guidelines which is needed to be done during pregnancy. But if your mother-in-law is there, you will have to, because she will be little stricter, right? And you will have to follow certain things which is right for you and right for your baby. So my experience became really wonderful. And I never had that feeling that there is nobody to look after me, because there was my mother-in-law, right? So I did not go through, a feeling of, postpartum depression. Lucky enough to not have, gone through that experience. And also because she was here, like recently, 2 days ago, she went to Bombay. I also did not have that experience where I'm not sleeping for, multiple nights, and I'm not able to bond with my baby. Because of her, I could spend good quality time with my baby. I'm having a good experience with my baby. Now let's see what happens, because now she's gone to Bombay, and my husband and I, we are alone here. No matter how supportive or loving your husband is, but a woman's support is very different, which is required in the pregnancy. Also, when I took a project here in Bangalore, it was quite a big project. After 2 weeks, I realized that I was pregnant. So my husband and I, we thought instead of dwelling completely into pregnancy, we will make pregnancy part of our life. And because we made pregnancy as a part of our life, it was very easy for me to, operate on a day-to-day basis because I was so occupied mentally with my vendors, with my clients, doing my job, which I love the most. I didn't even realize how I, experienced the whole 9 months. And I was at the delivery bed. So overall, my experience was really, really good, Shama.
Thank you so much, Priyanka, for sharing your experience with us. So, I take this moment to thank all the panel members, my friend Palash Agni, and all of our audience. This whole recording is going to be available on Palash Agni Studios YouTube channel and on Facebook page of Antarman Center for Psychosocial Wellbeing. Also, contact details of the panel members are given out with the consent of them. If you are interested, you can contact them offline as well. This was a small attempt to continue to bring out mental health issues. Feel free to comment on how you like this, how you would like us to improve, and any other topic which you would like us to bring out.
Spoken about how coming back from a delivery, it automatically is very challenging for a woman. So it becomes very difficult to compete at an equal level with men. Like it can be good on paper and in debates, but practically career does take a hit because you do have additional responsibilities and a lot of mom guilt, and you have been absent from work for a long time, and delivery process in itself physically, mentally pushes down, demands a lot from your body. And I was surprised at the amount of understanding I got because I was not expecting any. I really thought that people would just be like, I'm just doing a little bit of men bashing or whatever, but it is true. So I think speaking out and not making this a taboo or something like it can happen with someone but it cannot happen with me, not having that kind of hang-ups or mental blocks could help. So I think we should talk more often. Like I think nowadays, as a gynecologist, a lot of people are open about PMS. In fact, a lot of my friends who are recently married, my male friends, come up and ask to me, Shivani, what is PMS? Why is my this thing? Please tell us, like, how we can. So it is a very fresh change. Like I am very happy with that change. And I think all of us should be, I think we are going in the right direction. It just requires a little more structure and a little more supportive environment.
Would anybody like to add on to this?
I think Ravindra is trying to say something.
Yeah.
On mute.
Hi, Shama. Okay. Yeah, I would like to thank you, Priyanka, for pointing that out. I mean, after doing so many sessions, we still are clumsy when it comes to the mute button. So, Shama, I'm going to start speaking when you go to live stream me, or are you able to live stream all of us together?
Yes. Yes. Done.
So are all of us live streaming together? Then we can
Yes,
have a
yes.
discussion live. Oh, lovely. Oh, this is very nice. Very much better. Thank you, Palash Agni, for making this happen. So thank you, Shivani, for actually highlighting this, the challenge of a working mother and the mom guilt, and that is something which I would like to talk about. It is because I mean, as competitive as the modern world has become, and as much policies that we are trying to bring in order to make it easier for mothers to return back to work, we have to accept that it is still far from being ideal. And when a mother comes back to work, there is always this kind of a guilt, kind of feeling is that look, I've left my baby behind, and my family member, it could be her own mother, it could be mom-in-law, or it could be someone else. Sometimes it is a maid or a house help who's also contributing to the baby, to looking after the baby. There is this guilt, of me not being there for the mother. And in fact, many a times, work colleagues, even well-meaning work colleagues, who may really want to support their colleagues' career, may sometimes put pressure, on returning back to work. But sometimes it is the corporate pressure. But that is something which we have to recognize, and maybe the workplaces need to have more reforms in the policies for that to happen. Yeah, so maybe if Misha wants to comment on that, on this, I think Misha, what is your input on this?
So my personal experience, yes, I do agree. There is a pressure that comes in. In fact, every month I do get this ringing bell in my head that should I just be at home and look after my son, or should I just continue working? It's there that the pressure. It's not given by anyone directly, but it's just certain things of, is my baby being looked after properly, is it okay to leave the baby at home and go out for so many hours, or is it okay to take away this precious time and do what I want to do and not give the child what he wants to do. But uh, eventually it again boils down to all the support that you have at home, and if you have the right people to say the right things to yourself, to you, and if you are able to accept this change, because change is the only thing that is going to be so constant in your life. If you accept that every month you're going to have a change in my of heart or change in mind, it doesn't mean you always have to act on it. I mean, doesn't mean you have to always give up just because you get a thought. So you need to pull back and reassess and think about what's going to be great for the long term, and eventually get strength from yourself by itself. That's what I do.
Thank you, Misha. Thank you. Priyanka ji, is it okay if I asked you a small question here? Yeah. So thank you very much for sharing that experience. And and the reason the reason is I'm curious to ask you this question is, yes, you had a lot of support during your pregnancy, but despite that support, you did realize that it is no mean feat, and it is quite a lot of effort which a mother, especially someone like you, who was already working, went through. What I wanted to know is that, did at any point in the pregnancy, did it occur to you that, what is this is overwhelming, or this is really too much of effort, or it is not fair that why should only women have to go through this? And so basically what I'm trying to look for is that your recent experience, that depression being there or not there, it is how hard it is for a mother.
Well, I'll definitely answer this question. As far as my pregnancy was concerned, I'm 34. We planned this pregnancy, and I was really excited and overwhelmed with this pregnancy. So 9 months was, as I have told you, it was like a story. It was like a fairy tale for me. But what I experienced after pregnancy is something that I'm going to share with you.
Yeah.
So one thing was a realization to me that since my childhood, I was very fearful of getting injected for any reasons, okay? And despite following a regime of a good diet, a good, healthcare, everything, I had to go for a C-section. My doctor said that, it's a case of a normal delivery. And, in my mind, we were all okay that it's a normal delivery. But the day I got admitted, my cervix did not open. And then after a few hours, my doctor said that you have to go for a C-section. And as a family, we decided that, okay, we'll go for a C-section. I did that. But after, when I delivered, I was really wondering and thinking that why this happened, because I did everything right for a normal delivery. So why I had to go through the C-section? I did not get my answer. But my doctor also said a couple of things, that it can happen due to this, due to that. We don't know the exact reason. It is only when I met a homeopath, a doctor, while having a conversation with him, when they asked any number of questions to you, it was self-realization that, I was so fearful of getting injected. And the process when a doctor comes and she does certain physical tests with you, I really, pulled myself. And I got so scared of getting injected, and, that entire process really scared me. And maybe that is the reason I just could not support the whole process. So I had to go through that. Maybe that is the answer, right? That's one. After that, what happened, and during that period only, when you are approaching your due date, right? Your family, your friends, they start to call and text you. When is it happening, right? So I think that really made me anxious. That I don't know when it's going to happen. Why they all are asking me, kabhi ho raha hai, kabhi ho raha hai. I don't know. When it happen,
Pressure.
No. So, I really got pressurized. And I told my husband once that, now if anybody is asking you this question, you answer. Because a lot of time, when elders in your family, they're asking, you can't answer because then it's rude to answer them, then why are you asking this question? But it really bothered me in my 9th month. And then after that, breastfeeding, right? So as Nisha said, that, people will give free encyclopedia of their experiences, right? Which might not match with yours. So only 3 days I fed him, but it was not adequate for him, right? So then we started with the top feed. Then, of course, your friends and family, they love you, so they will share their own experiences. But that could be really overwhelming for you. How much to feed, not to feed, how much ml he is consuming from your breast. You don't know all of those things, right? And then of course, my milk was not adequate for him, so we had to give him top feed, right? So that period of 1 month, I was anxious. I don't know whether it was a depression or not, because I did not consult anybody. But I felt that anxiety that, oh my God, why it's happening? Why me? Why am I not able to feed my child? But then again, I met my doctor, and then she told me a lot of stories that, Priyanka, there are mothers where the kids are allergic to the mother milk, the breast milk, right? So at least you are the fortunate one who are able to give him something. Something is going inside him, right? So I think that meeting really helped. And I told myself that whatever is happening, I did everything best, in my knowledge, along with my husband. So now whatever is happening, I have to experience it. It's my unique body. My baby is unique. So I have to be happy with it. I have to make peace with the situation that is I am in right now. I did everything possible to increase the breast milk that you do, ghar ka nuska, homeopath, allopathy, every possible thing. But now I'm at a peace with it. That right now I know that top feed is not that great, but my baby is surviving on that. So for me, that's the best. And so today, I can say I have made peace with it, and I'm happy about it. But I did go through that moment where I was really questioning myself, and I was really questioning everything, related to breastfeeding. And I was not very happy about it.
True. I mean, thank you for sharing that, Priyanka, because you have kind of touched a topic which a lot of women are very anxious of, and I'm sure Shivani does come across that in her regular practice as well. I'm just going to share something which I had noticed sometimes. This is a few years back. We used to have a pediatrician at Manipal Hospital by name Akhil Rizwan. He's now left and moved to Hyderabad. But quite a nice guy, and I happened to kind of be in his OPD once. I just kind of say hello to him, and he was talking to a young mother. A very similar circumstances where she was very anxious. Doctor Saab, I'm not able to breastfeed, and she was like really worried about it. And he said, you know what? I am a formula milk baby. My mother could not feed me, and I have grown up on formula milk. देखो यार ठीक ठाक हो गया, डॉक्टर बन गया, है ना? So I want you to know that that you should not look at it with anxiety. That if you're not able to feed, then that means something wrong is going to happen, or the baby is going to be in some danger, or you have done some kind of a sin by not actually feeding. But anyways, I mean, Shivani is more qualified to be able to speak on that. So let me kind of ask Shivani to kind of add to that response.
Yeah, so I want to say that delivery is something which everyone experiences, and many people experience it more than once, and they would tell you that each pregnancy is different, let alone each person. So since everyone has undergone through the process and everyone has their own views about it, so there is a lot of correlation without causation. Like you think that if this is this, whereas there is no correlation. Whatever we are thinking, it may not be right. It may be like 2-3 people, they say that if the baby bump is, showing too much, it is a boy. If the baby bump is looking like it is a girl. And many people, they tell you by experience, and you are like, yeah, they are right, but they are bound to be right 50% of times, and sometimes like that. But that being said, the human body is such a wonderfully created machine, and the whole process of childbirth, lactation is such a wonderful thing. I would like to share that I know this for a fact, that I know that my grandmother, she breastfed her children for a good 2 years because of having children successively, ease of breastfeeding, a little bit less financial burden also when you breastfeed the baby. When I was born, the time period for exclusive breastfeeding was actually just 3 months. So the 6 month came in later. There is no hard and fast rule of what to do. There is just some basic outline principles. I know for the fact that women used to share their breast milk for their children, because it has always been a fact that some women have not been able to breastfeed. So if 2 women in a family, they deliver around the same time, it is a common practice to breastfeed the other one's child like that. So and we had the concept of daima, or women who are unrelated but used to take care of the baby, including feeding the baby. So there are a lot of things. We need to take things as they come. I really feel that a strong community could help us not put a lot of pressure on ourselves. Because when we just read what is there in scientific literature, papers, patient information sheets, that ingredient of natural knowledge, acceptance, ऐसा तो होता ही है, ये that thing goes. So it creates so much of stress and such a feeling of ये मेरे साथ क्यों हुआ. If you speak to all of our previous generations, they would say we delivered at home. We didn't even go to hospital, and हो जाता है. And that is because all of them who delivered are the ones who are surviving. The maternal mortality rate at that time was so high. It was common to have a second wife because the first one died in childbirth, a stepmother. Maternal mortality rates have gone down significantly. So just because of the expectation that delivery should be normal, it creates so much of a pressure when you deliver by cesarean that it feels kind of defeat, and it adds to the whole bundle of experience. And as it is cesarean, undergoing a cesarean section is a surgery, so it definitely has a toll on your body. So on top of recovering from the physical toll of a surgery, of a childbirth, of everything that comes along with it, comes this guilt or this feeling of inadequacy that the vaginal birth did not happen. Because even now many people feel that, oh, she could not take the pain, so she went in for a cesarean section. So there are like so many things around it. I feel a proper community support, and that too, very realistic community support with will tell you, okay, we have gone a long way and we are all okay, and our bodies will all behave in their own ways, and a baby will get what it needs from its mother. And if it doesn't get, then we live in an era where all the facilities are available. So we need not take stress of everything being in our control. I just want to stress on that. Like, I really feel that a very strong community support, wherein we can be very frank with each other, can help address the issue a little bit. And also, I think I did want to ask Misha and Dr. Ravinder regarding that. I want to stress on the fact that postpartum blues are common. Generally, they go away in 1 or 2 weeks. But why there is so much of stress on identifying persistent symptoms or a persistent feeling of is because the treatment of postpartum depression is also quite successful. So with the right kind of, being it support, being it counseling, being it medicine, this condition is also quite amenable to treatment. And majority of women do start feeling much better within 2-3 months of delivery as the hormonal effects stabilize. So I would like Dr. Agarwal and Misha to elaborate on this fact.
Sure. So let me go first, and then Misha, you may want to kind of add on to that. So your question is, why is there a stress?
No. I want you to tell that once we identify the problem, the treatment options which are there, like how successful and how easy are they for the patient?
So that's a very interesting question, is because again, what happens with pregnancy? Pregnancy is a time event. It's not a continuous. It's an event which happens, and many times what happens, mothers who suffer depression in their pregnancy, once they are no longer pregnant and once they are no longer in the postpartum period also, and this depression goes away, specifically if it is because of the condition of the pregnancy, that is the limitation and the social conditions around and adjustment. But why we want to stress so much is because it does affect the quality of the experience of motherhood, and we don't want a mother to remember that for the rest of her life as a potential trauma which she underwent. Second thing, what happens often is the early childhood, the early neonatal period is very critical for a neonate's cognitive brain development. A lot of mother-child bonding, a lot of learning, intellectual growth in the mind happens in the first year of the birth and in the first year of life. And if the mother is depressed during that period, it can actually affect. It is known to affect the ultimate cognitive outcome. So that's why it is very, very impactful. The treatment is very simple. A lot of people also fear, okay, that if a lot of mothers fear, family members, even if they know that, no, if we take her to a doctor will prescribe medicine, and we don't want the child to have, a mother to have any medicine either during the pregnancy or during the lactation period, which is a fair enough worry. But what I want to say from this forum is, these medicines, there are a lot of medicines which are available now which are completely safe in pregnancy and in the lactation as well. Usually, as a rule of thumb, all doctors would want to avoid any medicine if possible during pregnancy. Just good thing to avoid, and that too in the early pregnancy. But in the later pregnancy, it is possible to give medicine if it is absolutely needed. And that need would be when the risk of not giving the medicine is going to be harmful to the mother and obviously to the child. But besides that, there are very effective counseling options which are available in the pregnancy period and in the immediate postpartum period. And these counseling options could be actually seeing a psychologist such as Misha or Shama. And in those areas where I mean, it's in places like Goa and all, we do have a higher, much more frequent availability of mental health professionals like me and Misha and Shama. But there are parts of India where we don't have this, where there are hardly any mental health professionals. There it is possible that you can, a trained frontline health worker like an ASHA worker or an auxiliary nurse midwife or any other lay counselor, adequately trained, brief trainings can also be trained to give counseling. So I'm going to now hand it over to Misha to complete, to add what I've said. And there is one question which I will, after that, immediately, which Shama has just sent me. Unfortunately, I think she's not able to join this live stream. So she sent me a question which I'm going to ask, or I'm going to respond to that later. Over to you, Misha.
So I'll just quickly add on to whatever Dr. Ravindra Agarwal said, that yes, definitely the amount of evolution that has happened now is wonderful. There is along with psychotherapy and counseling therapy and techniques, there is support groups that really help mothers to address their issues, talk about them, and get a collective intervention plan, which again is very new to this generation, and it's available on many forums and even through psychologists and psychiatrists. So I think it's very relatable, and I think the best solution in the given scenario, along with medication definitely, if needed. They go hand in hand, and talk therapy, best thing that a mother could receive.
Absolutely, Misha. I would recommend talk therapy or counseling anytime more than medication, simply because the new evidence, the research evidence which is coming through, is that people who undergo talk therapy or counseling or psychotherapy, whatever you may call it, they tend to do better in future also, because what happens is, as part of that relationship, that counseling process, you land up learning skills which you kind of keep using whenever you face any adversity. So obviously medicine is only if there is no other option, but if that option needs to be needed, I always recommend should be done, should be taken, because the advantages far outweigh the risks. And talk therapy as much as possible. Or up to post-pandemic, the world has come to realize the online model as well, and the world has shifted in favor of online. So now it is possible to take talk therapy from anywhere in the world, in your own language, from wherever on the globe. Shama just messaged me that she's able to ask the question, so she's going to come online and ask. Shama, if you can.
Yes. So we have a question. Does this maternal depression occur in the second child pregnancy journey too? Because some women don't want to have the second child because of the first bad experience. Also, if yes, is there any cure for this mental health condition?
Okay, so I'll take that question, Shama. Thank you. So, so there are two things which we need to. We have talked about pregnancy blues, postnatal or perinatal depression, but there's something else also about episodes of mood disorders in pregnancy. So here we are talking about mainstream mood disorders like depression, or we're also talking about disorders such as bipolar disorder, which is a disorder in which people can alternate or can have both episodes of low mood or of mania. So now it has been seen that women who undergo an episode of bipolar, who suffer a bipolar episode, either depression or mania during pregnancy, then the chance of it recurring in the future pregnancy is actually quite high. So that is something which we often say. So if women has got any episode which requires psychiatric consultation, then we always say that, you know what, that in future pregnancy the risk will always. It doesn't mean the risk is 100%. I'm not saying that, but the risk is higher than of it not happening for someone who didn't have. when it comes to about if you're getting depression in pregnancy, it and if obviously depression was not adequately treated and mother kind of suffered and there's some kind of a trauma memory which is there, then obviously I can understand why someone would be hesitant to kind of go for the second pregnancy again. So to summarize the answer, it is that if one is depressed or has any mood disorder in the pregnancy, in a previous pregnancy than in happening in the future pregnancy, yes, the risk is higher, but it is not that high that one should not consider getting pregnant again. But obviously, if that has happened, one should say ensure that in the next pregnancy, adequate help is available.
Thank you so much. So we have another question with us. Does maternal depression affect the child too?
So yes, I mean I've said this earlier. Maternal depression does have an impact on the child. It has an impact on the child's outcomes. Like if we start from pregnancy, then it has been shown that if the mothers are depressed during the pregnancy, then the pregnancy outcomes, like the incidences of cesarean section or incidences of
Labor.
just yeah, just prolonged labor and other procedures which have to be used just seem to be more in mothers who are depressed. Immediately after the delivery, then the time to cry, the failure to thrive, low birth weight, those issues are found to be higher. Again, I want to clarify that I am not saying that these are causative events. I'm not saying that a mother is depressed, it is going to cause a cesarean section or it is going to cause low birth weight, but these are found to be much more frequently. So that means there is a contributory factor. These do contribute to these outcomes. And of course, the growth of the child, the mental growth of the child if the mother is depressed, because she's not going to play as much, there are not going to be so much of engagement with the child, and that is obviously going to have an impact. It is also shown that somehow the immunizations don't get completed. Those children tend to get admitted to the hospital more often with diarrheal episodes. There is low weight gain during the growth curve, the early growth curve. So all these are all impact which kind of indicates that if a mother is depressed, then it is going to have an impact on the child as well.
Thank you, Dr. Agarwal. Does anybody have anything to add to this?
I think I'll just add one thing here. I also realized that when I was pregnant for 9 months, what happened, a lot of people tend to share some experiences for your own good, of course, but that stories or that experiences could be negative for you. For example, somebody told me that, don't do this or do this. This leads to stillbirth. And oh my God, I got really scared. And that played with my mind for almost a month. Because anything I do, oh yeah, I remember. So do not sleep on your right hand side, sleep on your left hand side only. And you get really, tired by just sleeping one side. And by mistake also, if you turn to your right, you're like, oh, that story will, pop up into your head. And that really played with my mind. So I really made sure after that, if anybody is about to share a story, which I know is not going to be a good one, I will just stop them that, please, I don't want to know. You keep it to yourself, tell me once my baby is here. So I think it is very important to make sure that make your do's and don'ts, especially with your family and your husband, clear. And make your comfort that what are you comfortable with, what you are not, be your space, be the people that you like or don't like, and the stories that you would like to listen and don't listen. It really played a big role, which was my biggest learning. So yeah.
Thank you, Prem.
Yes, thank you so much. So I would like to take this moment to thank all the panel members again And thanks to my friend Palash Agni to make this all easier for us. So if you have any suggestions so that for any other topic that we can bring out next time, do write it in the comment section. Thank you.
Thank you.
Thank you.
Thank you. Thank you.